We're going to move in and talk a little bit more about our first responder support line. And I believe John is going to join us. He is a volunteer and a coordinator and helps us provide that service to the community. He's actually someone who answers that line if you call.
Yeah, hi. How is everyone this beautiful day?
Hi, John. Thank you. Thank you for joining us. John, tell us, what is the First Responder Support Team?
Okay, we are a specially trained peer support. Everybody that answers the call is either a retired or presently working as a first responder, either police, fire, EMS, dispatcher, and we're here to be able to help anybody that is having any type of problem. If you're having a problem with work situations, a bad call, if you're having a problem with your spouse, we're here to be able to have you call us, and we have big ears, is what I'd say. We have real big ears to be able to listen to you and see if we can work out this situation a little bit with you and hopefully get you in a better place.
So this is a peer support line that is for first responders, right?
Yes, just for first responders.
Okay. And during the pandemic, did I hear correctly that this line is opened up to healthcare professionals as well?
Yes, all the frontline workers. It opened up to them, and it's actually done pretty well with that. We've gotten a handful of calls because of that. They see just as much as the first responders do, and see more death and more problems at times.
Well, there's a partnership there, right? I feel like the frontline workers, having worked in the healthcare field, I think that the partnership with first responders and healthcare professionals, yes, is one and the same sometimes, right?
Yeah, we work all hand in hand.
John, is this for the Bucks County residents only?
That's what it started out as, but we've actually have expanded out to Allegheny County. We've had people calling us from other states also, Virginia, Washington, all over the place. So it's mainly for Bucks County first responders, but we will take calls from anybody and help anybody out there, because what we're finding out is there's different states that don't have the system set up like we have here in Bucks County. We're very lucky to have all the crisis intervention people that we do. Especially down in Virginia, we've received a few calls from down there because there's just nobody to call for first responders.
That's great. So you're saying if you call from Montgomery County or Virginia, you're not going to turn them away.
Never let anybody turn anyone away. Never.
Now, what about family members of first responders? Is this something that they could utilize?
Yes, they can. That's one thing that we've been trying to work on and getting the word out, that it's not just for the first responders, because the family members of first responders see and sometimes feel what's going on with whoever is actually responding to these calls. They come home, they flip out, they have problems. So we've opened it up to everybody, the whole family, to be able to have them come in and talk to us.
So I'm seeing here, what is the number for this line?
Okay, it's 267-893-5400. That is for what happens is you call that number. It actually goes to the crisis center in either Doylestown or Lower Bucks, and all they have to do is that they want to talk to a first responder, or that they are a first responder, and what they do is crisis will forward it to one of the on-call members that uses cell phones to be able to talk to them. We've had people call up and just say, "Hey, I'm having a problem," and they have. We've talked to people for 5 minutes, and we've talked to people for 2.5 hours, just to try to help them through whatever problem they're having.
Is this number available 24 hours a day?
24/7. We're always there, ready to help out.
What if you get a first responder that is calling and in some kind of crisis, like having thoughts that they want to die by suicide? Is this the right number to call if they're feeling that way?
We would prefer them to call 911, but if they do call us, we will help them and most likely call 911 for them, but we will help them through whatever problems they're having. Because we do not go out to the call. We are just strictly on the phones, but we will get them help as soon as possible.
John, if somebody's already seeing a therapist or a professional, can they still call you first?
Sure can. We've actually had many calls that way where they're actually seeing therapists on a regular basis, and for some reason they can't get to them, especially during this pandemic. They're having a tough time getting to the therapist, so they call us, and like I said, we'll listen to anything they have, any problems they have, and we try working with them. If they don't have a therapist, we actually have resources throughout inter-county and out-of-county where we can refer them to the people, either in treatment, out treatment, to be able to help them out.
That's great. And one thing I learned is that when you were looking for resources, you truly vetted these out to know that these are professional resources that work well with first responders. Isn't that correct?
Yes. Everybody that we've talked to is either a first responder, has worked with first responders for many years, and they're willing to work with them, bring them in, and they have some idea what the problems are that they're going through, or may have been actually in that problem before. May have had that rough call that a death they've seen, or any other problems they've had.
So, John, if people wanted more information about this, who or how do they go about getting more information? What if a first responder wanted to bring this to, if they're a firehouse or something like that? What do they do? How do they go about getting information?
Okay. They can call that hotline, and they will get in touch most likely with me or Nicole Wolf, and we will get them either a flyer, business cards, or we will come out to their station, to their headquarters, and actually give a talk about it and let them know firsthand what's going on. We do everything we can to work with them to be able to get it out. We really do.
Is there anything that First would need to help with this cause? Anything that you need?
One of the best things would be donations. We don't actively ask for donations, but just be able to help with the cell phones and some of the advertising costs that we have. We are all volunteer, and it is all confidential. But we just need the some donations, and you can send them to Lenape Valley Foundation, and then make sure you put down First Responder Support Team, and that way we will receive it. We also may need some more call takers soon. So if anyone is retired that is a first responder or was a first responder, please get in touch with us, and we'll see if we can get you the training and get you on board. And we need more people to talk about it, get the people out there and make sure people are aware of it. Finding out a lot of first responders, even though we have flyers and we've talked to numerous people, they don't know about this. And what some people are thinking, because I've talked to some and they go, well, it's only for work-related problems. Well, it's not. It's for anybody, either a personal problem, work-related problem. It could be a spousal problem. It could be one of your kids got you mad and you just need to vent. So you can just call us up and just scream at us if you want, and just let us know, hey, we're having a problem, and vent it out. People just need to talk.
Well, thank you so much, John. I mean, one thing that we know is first responders like to talk to first responders, right? Especially, they have an understanding of what they're doing. So I appreciate so much of what you do for this county and for this line. One thing I learned about John is he is a first responder in almost everything. He's a retired police officer, firefighter. He has been such an asset to our community. So thank you so much. And he continues to keep giving to the community. So once again, I am just so privileged to work in Bucks County with such wonderful people. Thank you.
Thank you.
Thank you, and thank you for the opportunity to talk online here and let people try to hopefully let more people know about us.
Yes, we're getting the word out. Thank you, John.
Thank you.
Thanks.
Bye-bye now.